Hi everyone, this is Kana Nivert here from Whole Woman Cells of Baltimore. I am the administrative coordinator with the clinic, which basically means that I am a patient counselor and the outreach coordinator, community outreach educator. And I wanted to put together a quick presentation and a quick video about what it has been like to work in sexual health care, reproductive health care, providing abortion care during the COVID-19 pandemic. Um, Little disclaimer in the beginning, I'm not a physician. And everything that I'm going over today with you is not to be used as medical advice. This is just giving some background information and cultural understanding of what it has been like to, provide this care in COVID. The other thing is people might be wondering, oh, what a strange kind of like mixture to add into DIY Fest. But in reality, this work that I do, this work that our team does every single day at our clinic, really has a major impact on our community, which I plan to go over some of those particular some of that information with all of you. I'm also going to kind of go back, toggle between both, myself talking and a PowerPoint that I put together. The PowerPoint will have some information at the end for you on kind of like community action ideas and also websites, contact information, things along those lines. So we're going to go ahead and get started. I'm going to go ahead and share my screen with you and kind of go over first some of the barriers that we have faced providing this care, particularly during COVID. So I will go ahead and share my screen with you. So again, we're talking today about sexual and reproductive health care during COVID-19. Hitting back home with the fact that abortion is essential health care. There was a lot of talk at the beginning and throughout this pandemic that the care that we provide, which is a mixture of pregnancy termination / abortion care, sexual health care, wellness care, pregnancy care for, folks. All of those things are critical services that need to be accessible no matter what is going on in the world around us. So let me move forward with this. So when we're talking about additional barriers, if you look on this list, a lot of these are barriers that are not new. They've existed for all of eternity. They've been in place. We're constantly revisiting these barriers every single time we're trying to schedule a patient, to come to see us. But there's been some additions added into this list, and I kind of want to touch on those a little bit. So one of the number one factors always for people is obviously cost, money, being able to afford the services that they need. So additional barriers, there's a heavier, if you will, amount of unemployment, loss of income. People have lost their insurance coverage. There's been a really difficult ability to apply for insurance during this particular pandemic, specifically to Maryland. In the state of Maryland, most Medicaid will cover the services that we provide for most patients. So even people with private insurance who have lost their job or they've lost insurance coverage, they should be able to apply through the state of Maryland, through the exchange, through the healthcare exchange, to get at least temporary coverage to make sure that they have access to healthcare. Unfortunately, a lot of the people that are staffing the hotlines and the chats and the offices that are providing that service, a lot of that has been super delayed. People haven't been in those offices. When I've spoken with patients, people are telling me that they're being told it could be a 2 to 3-month wait for them to even be able to become eligible for insurance, which is insane. Obviously, when we're talking about pregnancy and care of pregnant people, we know that there is a time constraint generally on those services. People need to be able to get in and get seen. So when people are trying to apply for temporary insurance so they can get in, they're being met with a lot of additional roadblocks that maybe wouldn't normally be there in quite this large of a capacity. The other thing is there's a strain on the abortion funds. So both National Abortion Fund, Baltimore Abortion Fund, the DC Abortion Fund, some of the other funds, even across the country, there's a big strain because the abortion funds rely on donation. So when people don't have the money to pay basic life necessities, they're generally not going to have money to donate to the abortion funds. So there's been a, somewhat of a significant strain on being able to fundraise to be able to help people that need financial assistance to pay for services. And also, most patients at this point don't have anyone that they can borrow money from. Like, how do you go and talk to somebody about money that you need for a service when, again, most people are just trying to make ends meet? So that's the first one. Secondly, I also want to talk for a second about transportation. So travel restrictions is a huge one. We get a lot of out-of-state patients that are coming to us because their state has either temporarily put restriction on the ability to obtain abortion care, or they have things in place where it's additional challenges like long waiting periods, other types of things that are making it very difficult for people to get care in the state that they're in. So because we get so many out-of-state patients, when a lot of these travel bans came into place, people were thinking, okay, so how do I get from, like, let's say, North Carolina to Maryland without having to quarantine for 14 days? Where do you quarantine when you're coming from out of state for a medical procedure? And usually the plan would be to return to your state. And first of all, they also have to get into Maryland. And as many of us know, getting into Maryland during all of this, when they had high-level surveillance on people coming in and out across, state highways and stuff, became really problematic. We actually started to, in some instances, even just like, provide documentation that a patient was coming into Maryland for an out-of-state procedure that they could not get in state. But at the same time, you don't want to show somebody a piece of paper saying, oh, I'm going to Maryland necessarily for an abortion. The other issue is people have lost personal vehicles. They can no longer afford their car insurance or payments on their car. Also, limited public transportation. Okay, so Maryland, particularly Baltimore City, has put in a lot of limitations on being able to have access to the bus, all the bus routes. You had a lot of MTA staff that were getting sick from COVID that were not able to come to work, wasn't safe for them to come to work. So when that happens, there's a trickle down where also people who are trying to make medical appointments, they can't get there. So that is another issue. Same with light rail, same with the MARC train and things along those lines. And also with a loss of personal vehicle means also that there are some patients that don't have anyone to come with them. And while that is certainly the case, oftentimes, whether or not there's a pandemic, it's particularly problematic in the middle of something where how do you ask someone to drive you somewhere when you're supposed to be social distancing? I also want to talk for a minute about childcare. So limited or no help watching children. Can't have somebody come to your home to watch your child. Can't take your child to someone else. You've got issues with virtual schooling where children need to you know, have support with them while they're also trying to engage in school activities. Um, Childcare has always been a barrier for people trying to access care, but is particularly problematic when where do you take your children, right? So our clinic, for example, like Whole Woman's Health, to protect both patients and staff and people's companions, we still maintain that the only people allowed physically in the clinic are going to be patients. Patient companions have to wait outside. We're doing that for social distancing reasons in the waiting room. We're doing that as a protection for everyone working there, also for patients. We're trying to limit, you know, face-to-face contact. The last thing that we could be set up for would be having children in the waiting room either. So it's a problem. Also, a huge one that nobody's really been talking about is lack of privacy and support. So there's been limited or no privacy. For example, if you are a patient and you are planning to do the at-home medication abortion pill method, you may or may not have privacy to take your medicine, to go through this process. You know, again, how do you separate and give yourself space necessarily from your family members that you're living with? How do you find someone who can watch your children while you're going through some of the more difficult parts of the at-home process? I mean, essentially with a medication abortion, you are self-managing your own miscarriage, right? So how do we get privacy for patients that are doing that at home? The other issue with privacy and support and lack thereof, finding somebody to come with the patient, having someone be able to pick the patient up, get them home safely so that they can have sedation with a surgical procedure, and just overall difficulty asking for help. Lastly, another main issue, providers are closed or have limited hours. Whole Woman's Health of Baltimore has been open the entire time of the duration of COVID-19. And we have been seeing patients and making, you know, the best, safest accommodations possible to make sure that we can still deliver care to people that need to come see us. We have limited our services. You know, we're thankfully at a point where we are now opening back up and we are able to see people for much more, you know, types of things. But there is still limitation on how many people we can have in the clinic, you know, what's a safe number of people to have, you know, and making sure that we can be staffed properly as well. You know, you got to make sure that you have enough staff to take care of all the patients. And we've been really lucky. I work with an incredible team of people. So proud to work with the people I work with at our clinic, both my peers, co-workers, and our docs. Everyone has been absolutely incredible through this process. But having said that, again, there are these limitations on what we can and can't do as a result. I want to talk a little bit also about critical compromises in care. So if you look at this list, the main thing that I'm trying to hit home with today, COVID-19 has caused significant delays in timely care. That is not just the care we provide, that is the care that many other healthcare providers are involved with, but it most certainly impacts the work we do. So there's been limited or no access to contraceptive measures. What does that mean? It means people can't get their birth control. They can't get it. They can't get in, they can't get an appointment. They have no way to get to the clinic. They cannot get to their regular doctor. They cannot get checkups they need. They cannot get new birth control started. So that's been an issue for people. Another major issue, limited or no access to STI testing or treatment. So you have people that really desperately need to get tested for this or that, can't get in, can't get the prescriptions they need, can't get seen. Limited or no access for psychological and emotional health care. So word on the street is everybody keeps telling people, oh, if you're having a hard time with all this, you should get a therapist. Well, that's great and all, except for most mental health professionals, most therapists, most psychiatrists, most psychologists right now, they're not taking new patients. They are barely able to work with the patient load that they have, right? So now all of a sudden you have people that desperately need to get seen, to get on medication, to have counseling sessions outside the scope of what we're able to provide. You have folks that have been, taken off their medication because they're pregnant, they don't know how to get back started. So the access to emotional and psychological care is not good. Also, no access to cancer screening. Out the window. Doctors' offices are saying to people, come back in, 3 or 6 months or whatever. Limited access to urgent care needs. We all know that people who need like quick urgent care may or may not be able to get in someplace, and if they do, the wait times may be severe. Limited access to medications, refills, Plan B. This is a big one. Big. We made a lot of accommodations for people to try to make sure that they have access to the medicines they need, but that is not the case for all people. People have called us out of desperation for authorization on new prescriptions because when they're calling their own doctor's office to get refills for medication, nobody's answering the phones. They can't get through to anyone. The pharmacies, are not going to just float them for more than a month and things like that. Plan B is also, the morning after pill, Plan B. It's been hard to come by because a lot of people are relying on it for, their birth control right now. Also, limited access to pregnancy care of any kind, prenatal, postpartum, all of these things have been compromised for a lot of people. People have not been able to access the care that they need. Restricted access to support and companions during care. We've all talked about this. So you go to hospital, you go to have your baby, you go into labor. There are restrictions, high restrictions on who's allowed in there with you. What does your support look like? A lot of us in this work have been trying to do some virtual care, but even that is like a newer thing for a lot of us. So we're still trying to optimize what that looks like. But in speaking with a lot of patients, they're not getting the care that they need. I have patients that come to see us at the clinic. They decide they're going to keep their pregnancy. They decide that they're going to move forward, and they don't know where to go because there's such a delay in getting in somewhere in order to get prenatal care. And then also people are self-limiting on obtaining and receiving care based on risk. People for two reasons. So think about this twofold. Someone who has underlying medical conditions, who knows how risky it is to be out and about, they may limit the kind of chance they're going to take. They may delay their own care out of fear. So you have that issue. You also have people that work high-risk jobs that are afraid to come into a medical office and risk, exposure and things along those lines. You also have self-limitation. I wanted to talk a little bit about the impact of COVID on our community. So in Maryland, we still have provider deserts. What that means is we have areas of Maryland where people cannot access sexual health care, reproductive health care, abortion care, Your main areas you're thinking are going to be like, Western Maryland, Southern Maryland, and Eastern Shore. People are going to have to travel just like they always do from those areas several hours to get to, say, Baltimore to get care. But it becomes much more difficult when we talk about those other barriers. So how do you get a ride? How do you get back and forth from your appointment to back home? Who do you rely on for childcare when you're adding an extra 3 hours to the clinic and 3 hours home, plus all the time that you're spending there? So those are all issues. Again, we talked about pregnant people with certain medical conditions cannot safely leave their home or travel. High-risk job exposure. Also, pregnant people do not have good information about the side or possible side effects of COVID-19 on their babies or on themselves. Most days when I have a patient sitting in the room with me and I'm talking with them about their decision and what their plan is, we talk about the we don't know. That we don't know. We don't know what this particular virus, what is COVID-19's role going to look like in how it affects both the fetus, baby when it's born, and the person who's pregnant. What is that going to look like? And the reality is we have very little information, and the information we do have, we're trying to find it from the most reliable sources possible, and it's very challenging. And most of the information that we do have sometimes is advocating for things that as a healthcare community we don't agree with. So there's that. Also, a lot of pregnant people are told to postpone their appointments, including their first ultrasound, prenatal consultation. Even people with high-risk pregnancies have been told, you should just wait a while before you come in because we can't really see you right now. And then I wanted to talk for a second about community support. What can we do as a community in Baltimore, as a community in Maryland? What can we do to support sexual and reproductive health care? And this is where I tie this in with DIY Fest, because when we're talking about DIY Fest, we're also talking about what are some of the ways that we can advocate, self-advocate outside the scope of like more traditional routes for dealing with things. Some of the things on this list are pretty, pretty self-explanatory, but they're important. So financial donation and virtual volunteering with local abortion funds. Not everybody can do that. Again, money, right? Lots of people do not have money right now for donation. However, the local abortion funds may have opportunity for people to volunteer, even if it's literally 1 or 2 days, a couple hours a month, where you're on the phone, you're helping to screen patients, you're helping to talk with people. If that is something that you might be interested in, I would highly recommend you reach out and see what kind of role you can play in that particular way of support. I put the nnaf.org on there. That's basically the National Network for Abortion Funds, which if you go on their website, it will tell you about all the funds. And then you can look specifically for the ones for Baltimore and DC. Another thing that's important is distributing like information about vetted clinics, programs, resources in our area via social media, listservs, community spaces, etc. Vetted clinics. What I mean by that is making sure that we're sending people to places where they can get safe care, accurate care, legal care, care that is inclusive, care that is going to not harm people and not traumatize people. So when you're looking at information to share with other people, definitely do some research, just like you should be fact-checking news and news sources. It's really similar with this work too. I will tell you that the National Abortion Fund has a list of NAF accredited clinics, which is a great starting place. But also reaching out to like NARAL, Pro-Choice Maryland, and some of the other organizations that are heavily involved in repro health within our state are really good. And that brings me to number 3, connecting with local repro and sexual health organizations to support their needs and projects. Definitely jump on these websites, see what kind of work you might be able to do at the local level. Also, number 4, check to see if you can provide practical support donation to abortion care providers. So things like sending notes of support to patients, doctors or staff, sending a care patient to staff at a clinic, asking the clinic if they could use, like, you know, some donations of items such as pads and wipes and things like that. I would definitely email any clinic that you're interested in doing some partnership work with directly to see what their needs are, because everyone's needs are going to be a little bit different. And then also, guys, if you can just be a supportive listener for pregnant people in your community. I mean, that is big one. Like, when I'm talking with patients right now, the number one thing they say is they just feel like they haven't had anyone to talk to about this. So if you've got pregnant people who are opening up to you, they're trying to make decisions about their pregnancy, about their families, about their health care, just be an ear for people, be an active listener. And also, lastly, we've got to continue to contact elected officials. We have to push them, and we have to push them hard for increased resources to address COVID-19 within our communities. These people are elected. We all know that that comes with all kinds of its own issues. However, elected officials need to be held accountable. They need to be held responsible. They need to be transparent with people within this community, and we need to actively speak up, and we need to push them, and we need to be blatantly honest about the things that we need in order to do this work and keep patients in our community safe. So this particular page, I just wanted to give you guys an idea about like the kind of work we do at Whole Woman's Health of Baltimore. So this is just a list of the kind of services that we offer. One of the things that's a little bit different, the National Abortion Federation has basically written a protocol so that clinics can now provide the medication pill abortion up to 11 weeks. That's actually an additional week over what we've all been doing for a long time, which is 10 weeks. So most of your NAF clinics are now probably going to 11 weeks. And that makes a real big difference for people that really want to opt for the medication abortion route as opposed to surgery. And then again, these other things that we have on this list are all things that we have more recently had enough staffing and set up so that we can reintroduce these options to people. And then lastly, here's a list of resources, my contact information. I'm very transparent on social media. You can add me on Facebook, you can add me on LinkedIn, we can chat through Messenger, we can chat through email, we can chat through text. I'm happy to answer any questions that people have, more specifically about what you can do within your own community surrounding work that pertains to sexual and reproductive health. I've listed some organizations that I think are great to check out. And, just reach out to me if you have questions. I really wanted to put this presentation together because I felt like it was really important for people in our community to know the challenges that COVID-19 has brought to this work. Also, I will tell you that this work has only gotten more difficult through COVID-19. It hasn't gotten easier. So even though we've been doing this now for, oh my goodness, well, I mean, really since March, even earlier, February, end of February, it's gotten harder. And it's not just harder at Whole Woman's Health. It is harder at a lot of other clinics, a lot of other medical offices. Um, you know, like so many other people, this work is really hard. It's really challenging. People are like super high alert. Lots of big feelings right now about pregnancy, about, you know, even going through just having, you know, an abortion. There's like a lot of big extra feelings, and all those barriers play a factor. You know, even just one of those barriers can make it really difficult for people to get the care that they need. So my hope today is that the takeaway, and actually I'm going to stop sharing my screen. Let's see. My hope today, my hope for your takeaway is just awareness about this work, awareness that we're trying to make sure we can actively continue to see people in our community, awareness that we are definitely trying to hold safe space still for people, and just letting you know that there are opportunities for folks to support our work, for folks to support lots of other organizations within Baltimore, as we continue to provide care to people through this pandemic. I appreciate you listening to me today. Please reach out if you have any other questions, and stay safe, and be well. Thank you.